So as therapists, of course, we all make mistakes, right? Um, I think about mistakes in a couple of ways. So one is often, and there isn't just one mistake that I've made. I'll give a specific example in a moment. But when I feel like I've made a mistake, it's often, I think, because of a poor fit between the client and what I'm trying to do. And so I think mistakes are relative. What may be a mistake with one client may totally not be a mistake with another client. And so part of, I think, our task as therapists is to attend to that notion of fit, right? To be as attuned as possible with our client, and meeting the client where they are rather than imposing, right? Well, this client has generalized anxiety disorder, therefore this is the treatment I'm going to do in this order. Now, I am all for evidence-based practice, and it's something that I think is critical for our work and for our integrity as a profession. But I think we need to be careful in the context of empirically supported treatments and evidence-based practice not to default into a one-size-fits-all. And so I think sometimes mistakes can emerge from that one-size-fits-all way of working that says this client has whatever disorder and here's what I should be doing with that, right? But rather kind of taking a step back, and also, as our evidence-based guidelines, practice guidelines say, bring in consideration of client preferences, client values, client characteristics, client culture, right? So all of those things help to shape how we implement our evidence-based practices, our empirically supported treatments. And so I think many of our mistakes come from that poor fit. We're intervening and not doing such a great job of meeting the client where the client is. So an example that I can give from my own work is a client that came in presenting with depression, but she was also very overweight and indicated that another treatment goal for her was to work on her weight and try to lose weight. And I think the mistake I made was moving too quickly into behavioral strategies for weight loss, right? So while this was a goal of hers, it was not a good fit for what she needed initially, which was, woven into her depression was such a sense of low self-worth, such a sense of lack of esteem and value. And so I think that for me, the mistake I made was the order was off. I entered in a behavioral place thinking I can give her the tools, right? The evidence-based tools out there for managing some weight loss. So we know that, food diaries and tracking food is important. There's several things that we know, and that was not where I needed to enter with her. Right? So the mistake was not meeting her where she was, which initially her need was to get a greater sense of her worth in the world. So once I made that adjustment and we began focusing on her strengths and on, even enhancing strengths that she could identify in herself and using those in the world in a different way, using those more extensively in the world, and her esteem began to increase, then she was able to engage the behavioral strategies. But initially, jumping in with the behavioral strategies was a mistake, right? And that fit between the client and the intervention, I think, is the lesson that I take away. That I think a lot of our mistakes come from. It's not that what we're doing is wrong, but it's wrong for that client at that time.